Moment we'll have a break perhaps, but let us announce the next session, which actually follows up on what was suggested before, transformation or supplementation, because it will deal with the directions for growth. I think you don't need to be convinced that digitization is already decided, but it can assume many various forms. Abroad, this barrier have been brought down and the solutions were decided upon. So the next question is, which solutions should we adopt? This is the content or the thread that we have touched upon before, because it results from reconciling various divergent interests of various market players. Are we going to reconcile the old interests of the players, or will they be able to redefine those interests? I believe that more often than not, market players know how to define their interests, but they have to receive a response. For example, software vendors used to digitize medical services have their own needs. They will know what resources they have and which direction they should move. But this should also be met with a response by those who create standards and legislation standards in that respect. Right, because the tools are actually serve to resolve certain problems. We spoke about the COVID application, a notorious one. The idea and possibility should meet response by the population. You should convince the people that it's good, and people need to meet everyone else. You revisit the very important issue of values, because it showed us how important trust is. That implementation would have looked different in Scandinavia, where people trust the state, as opposed to Poland, where we have the lowest degree of trust to the, let's say, to the government, the state organization. For centuries, or for decades at least, we thought of the state as something oppressive. I don't think it's legacy anymore, because lots of decades passed since then, and we had many opportunities to build new trust. But the trust has been actually going up since 1989, and we have succeeded quite a lot. So I don't think we should put the blame on the communist Poland, because mistakes were done later. We are not going what went wrong. We're not going to change what went wrong in the past. We should focus on the future. I think this is something that we can use as a conclusion. I think that the COVID teaches us that we should respond to the crisis in a different way. If we have trust to the leaders, it's easier to overcome that crisis. And if we have a medical crisis, a pandemic crisis for that matter, and that crisis meets the crisis of the lack of trust, the situation doesn't look good.
So our moderator is Tomasz Judycki of the Polish Chamber of Healthcare IT. So let me introduce our panelists, keynote speakers, Marta Brożyna from the Ministry of Health and eHealth Center, and Michał Bedlicki from the Center for Quality Monitoring in Healthcare, and comments and discussions There is a whole list of eminent speakers: Marcin Grabowski from the National Polish Health Fund, Magdalena Kołodzi, We Patients Foundation, Compo Group, Medical Poland, Jan Pachocki, Rafał Włach, Compo Group Medical Polska, Jan Pachocki, Telemedical Working Group, Tomasz Zieliński, Vice President of Porozumienie Zielonogórskie, and Roman Kołek, member of the board of a Polski province. Okay, just to mention one thing, Marcin Grabowski, who is unfortunately sick. Well, we wish you health and swift recuperation. Marcin Grabowski was with us from the very beginning. He is one of the co-founders of this dialogue, which is taking place behind the stage. So Marcin, get well soon. And, you know, he texted me just a while ago. Okay, so Marcin, please visit us next year. Hello. Tomasz Judycki, I'll be moderating this session dedicated to development directions for Polish healthcare organizers. Have asked me to get answers to the following questions. How do we identify threats and opportunities? And do we identify the right question? Which question is right in terms of risks and opportunities? And we have two keynote speakers. So first of all, I will give the floor to Marta Brożyna from eHealth Center, who will shed some light on the health strategy, which is now in the working. Well, thank you very much. I'll wait for my presentation to pop up on the screen. Okay, I clicked on the screen, ladies and gentlemen. I will present key assumptions and guidelines we have identified for the health strategy for the years 2021-2025. So development of a sound strategy is possible when key stakeholders are committed to its designing, and we are working in interdisciplinary groups. We have representatives of e-providers, e-patients, health professionals, experts in various fields, as well as representatives of the Ministry of Health, National Polish Health Fund, providers of IT solutions. So this means that the strategy is drafted by a group of people who have very different perspectives of healthcare. In order to further develop healthcare in a planned and coordinated way, it is essential to write down certain principles, and this is exactly what we are doing while putting together the development strategy. Well, further development of e-health may respond to key issues of the Polish healthcare, such as the aging society or shortage of medical professionals. Well, the strategy puts the spotlight on all areas, including the central level, so P1, and registers, regional and local levels, so telemedicine and AI. Well, development of the strategy for the years 2021-2025 began with the diagnosis. Later, we described the status quo, and the diagnosis contributed to identification of what has been implemented and what is working, but it also identified key roadblocks that prevent introduction of new solutions or their fuller application. Later, we identified detailed objectives, so everything we want to achieve while working on the strategy. And in order to reach our target, we have created a roadmap listing very specific activities. So we are currently identifying the roadmap with expert teams, and this is probably the biggest milestone of strategy development. On later stages, activities will form the official strategy roadmap. So to date, we used a roadmap what assisted us in implementation of different components. For example, when we were deploying the regional and the central level, right now we are also implementing the same approach to ensure that solutions are implemented effectively and harmoniously, what will eventually contribute to execution of our main goal, or more effective healthcare services and dynamically growing e-medicine driven by health data which are available fast and widely used, and thanks to digital technologies. So e-health in Poland is growing dynamically. We are on the heels of implementing new solutions, and I think we should have robust foundations. So P1, which is the cornerstone of the entire healthcare system. So we have implemented e-prescriptions. E-referrals will be implemented shortly. Right now, the pilot implementation is in progress. On central level, we have launched two solutions: an app dedicated to health professionals, eGabinet.gov.pl, and an app dedicated to patients. So which is the online patient account, which provides access to your medical records, to your medical history, and possibly you can authorize other people, including healthcare professionals, to access this information. So patients' online account will be gradually expanded with new services, and at the end of the day, it should become the main touch point of the patient with the system. So the success of additional services we are implementing on the central level, and these include central registry and central e-appointments. Within 1 year, P1 system will be offering a number of practical functionalities in the healthcare system, which is why it's very important that new solutions are designed with P1 platform in mind, and that will ensure effective development of e-health in Poland. The central system also includes IT solutions. So our diagnosis identified that not all implemented systems respond to actual needs. We know that many of them have to be optimized and fine-tuned to current needs. So this is another thing we'll be working on. In case of different medical registers, there are several areas that need action. Key issues related to operations of medical registry is their dispersed character, low reliability and relevance of data, as well as lack of interoperability between different registers, what additionally translates into larger reporting burden. So very often, providers of medical services are committed to report very similar data sets to several dozen different IT systems, which is why this is another area that we are focusing on as part of our strategy. Well, development of telemedicine, this is a worldwide trend. This development has largely accelerated in times of COVID-19 pandemic. And I would like to add that centrally implemented services such as e-prescription or e-referral are additionally stimulating this development. So, for example, e-consultations are really rounding up telemedicine. Development dynamics of telemedicine is correlated with more funding that is available. Before the pandemic, there were just a handful of services, of teleservices available, and right now the Polish National Health Fund is offering a whole variety and is allocating funds, has increased funding. So our strategy mentions that several issues very specific to telemedicine need to be separately regulated. I think I'll discuss it in greater detail during the discussion panel. So we see an opportunity in development of AI and data analytics, because health data and analytics is vital. AI has massive potential, and if harnessed in the right way, it may offer measurable benefits for healthcare. So implementation of AI-based solutions requires, especially in healthcare, large data sets demonstrating high quality that will be comprehensible and transparent for algorithms. So the main roadblock, the main barrier to deployment and further development of AI is access to anonymized health data. So in order to boost the potential and to tap in more into AI, we need to take further steps, regulatory steps, and this is reflected by our strategy. So the diagnosis helped us identify detailed objectives which we want to achieve as a result of the strategy. And these includes achieving an effective IT architecture in the health sector, a wide variety of easily accessible e-services for patients, a common and shared electronic medical records, common and widely used telemedical solutions, and commonly used AI-based solutions. Well, like I've said, the strategy will describe measures that will contribute to achieving our goal in all listed areas. For each task, we will draft a detailed timetable. We will also identify business owners and stakeholders. We will identify an adequate budget. And the next slide depicts an example. It's a sample name of an action that will contribute to higher effectiveness of IT architecture in the healthcare sector. For example, simplified reporting for entities engaged in healthcare. So reporting will be mainly driven by P1 system and will be gradually phasing out other reporting channels. So in terms of gradual phasing out of other reporting channels, guidelines will be listed in the timetable attached to the strategy and will be covered by stage 2 of strategy implementation. So we currently plan to complete efforts in Q1 2021. We working as hard as possible in times of coronavirus pandemic. Very often we, as well as our experts, are often committed and involved in other projects. So the management of the center, and on my own behalf, I would like to express my gratitude to all authors of the strategy for their commitment. Thank you very much. Well, thank you very much for your presentation. I wanted to note your perfect timing. You've just made it right on time. And the next presentation on accreditation standards will be delivered by Deputy Director of the Center for Monitoring Quality of Quality in the Healthcare System, Michał Bedlicki. Oh, I think the mic is off. That's the problem. Okay, so you need to put the microphone on. Okay, so I do apologize. It was off. Okay, so can I have my presentation on the screen? Okay, good afternoon. Yes, can I start? Yep. Is it all right for me to start? Can I? Well, yes, you can. Well, Michał Bedlicki, the Center for Monitoring Quality in Healthcare. Well, Michał Bedlicki, thank you for inviting me to join this conference. I think that despite challenges today posed by this new COVID reality, you know, taking up the challenge of organizing and staging such conference, it deserves a lot of respect. Well, just like other speakers and participants, let me share my view on remote conferences. Of course, well, it's very practical that we can meet each other this way to exchange information, but, you know, this je ne sais quoi is missing, you know, this ability to meet up in the evening, you know, to chat together. So once again, thank you very much for the opportunity to listening to very interesting presentations, which I'm sure are coming up. So this part is dedicated to strategy. So I'm not going to talk about health strategy, but I would like to comment on what we do in terms of accreditation standards and our perspective of some elements relevant to healthcare. I will not dare to talk about health because I think the best example of how the strategy may change is the COVID crisis itself. Last year, probably, you know, strategically, we would agree that we are meeting in Sopot, and no one ever expected that we would be meeting remotely today. And on the other hand, another great example of how things are changing is today. Today, I had to work in the south of Poland. During the day, I was moving to Olsztyn. Meanwhile, I was listening to your conference when I was driving, and right now I'm in a hospital in Olsztyn, using IT technology to join the conference. And this demonstrates to what extent something we could not imagine has changed our life. You know, even in such simple aspects as communication. And coming back to health, the main objective is to improve the health status using IT tools. And can I have the next slide?
Takich pewnie kilku.
So several points that actually were broached in the previous presentations, namely the use of electronic means to control your own health as a patient, self-diagnostics, self-evaluation, self-care if possible. Also, what is very important is access to medical data, to collate the data that were usually available in a very distributed, dispersed way. Now you could possibly see all that data in one place, and also to view your history, to view your laboratory test results, telemedical pictures, and also to view your hospital admittance history. This transforms patients' perspective dramatically. Until now, the previous version, more organized patients could have accumulated file on oneself. For less organized patients, we couldn't see his previous records or have previous records upon admittance. Now this is changing very rapidly. The other thing is how to use medical technologies to look for, actually, in other words, to search the medical data, or if need be, in order to formulate a better diagnosis, to more precise diagnosis, more accurate diagnosis, and also to use the data to create evidence-based medicine, to look for answers to clinical questions, like if the path outlined by the clinicist can deliver better results. There's also a question of risk evaluation. We should direct the path for the patient to find better ways of treatment, or better way, the better treatment, or treatments that are better adapted to the patient. Another story is comparability of service providers, transparency, key KPI comparison. That fits in the whole area of monitoring the processes or indicators and processes that the service providers deliver, and also an evaluation that we do at the center, which is accreditation. We collect data that allows to understand better how service providers deliver their services. E-health, as we concluded before, is a very strong economic pillar that includes also modern technologies that operate as a driver for the growth of the medical-centered or medicine-centered IT technologies. What I have not had yet is about the use of e-technologies for medical education. We have recognized preparing of materials, accessibility to knowledge and education, the whole area of improving knowledge and awareness of the patients in a remote way. Of course, patients who is aware responds better to the treatment recommendations. I don't mean patients who actually center on Dr. Google, but patients who have accumulated high value knowledge content will be very much more easy to cooperate with. Also, the use of medical technologies for managing personnel at hospitals, looking for algorithms to better use the patient, to use them or utilize the staff. They also have a good positive effect on the costs. So e-health can translate into various perspectives, and of those that we can see on the slide, the one that I believe is the most important one is empowerment, including patients into the process of taking care of their health in a logical sense. We include patients thanks to via the medical technologies into the process of taking decisions about their own health. Another thing which I find important is ethics. Let me quickly translate all that into accreditation standards. One of the accreditation standards is about implementing secure information systems into a medical facility, supervising storage of medical data. 180 units participate in our exercise to test that, and only a few of them implemented the ISO 27001, which deal with information storage security. We are about to finalize the implementation of the GDPR code pertaining to personal data, and non-public entities will also have the opportunity to be audited in their use of that directive to check their compliance. Another part of education standards is this very simple standard, which says that the hospital provides Wi-Fi access to all the areas where services are provided. So the patient can, at every location, the patient can contact others with the internet. Of course, most of the patients already have smartphones. Some of them are still digitally excluded. They don't have any mobile devices to do that. I'd say that COVID prompts us to new solutions, like use of tablets or smartphones to connect patients with the families for critical cases and the most difficult times in the life of a patient. Another topic that I'd like to draw your attention to is that we ask the hospitals about how they transmit patient data to other collaborating units. Even though most of the units are capable of transferring that data, some of the facilities have not made that transition, or they don't fully utilize the potential of the solutions. So there are still apparently barriers in terms of transferring patient data outside medical facilities. So establishing such a database should be part and parcel of any strategic approach that is considered. Well, please bear with me for a second. I have a problem with my presentation. Could the organizers assist me in doing that? I don't see all the slides that I need.
Okej, no dobrze, no to jednym z ważnych standardów.
One of the standards that we're going to implement in the nearest future is that which deals with IT, or with a friendly IT system in the hospital. The standard prescribes lack of redundancy, the capability of the IT system to also draw data from mobile devices, to have easy logon into the medical system with the use of digital signature, while transferring the data outside. So these are the items that become part and parcel of the new standards for disease treating hospitals. However, there are also other standards which deal, or rather which address the facilities that perform invasion type of surgeries and so on and so forth, which are obligated to keep special surgery records, including the evaluation of surgery results. This standard will also allow to collaborate with external facilities and store data effectively. There is always a but. This was voiced earlier on too during a conference, namely the security of the patient's data. If we transfer data outside, we should always be mindful of anonymizing them and what is the exact purpose of them being collected and used further. Thank you very much, and I give the floor back to the conference room, to the moderators. Thank you very much for this presentation. We rather have a very interesting composition of the panel. We have the ministry, we have the academia, we have the province government, doctors, telemedicine, and programmers. We are now about to start the Q&A session. Please give us 3-minute short statements. I give the floor to Roman Kołek first, who is the member of the board of the Opolskie province. What's your take on that from the point of view of the provincial authorities? First off, thank you very much for the possibility of attending this conference being in the south, whereas the moderation is in Gdańsk, so all across Poland. Indeed, from the place where the local governments local governments are taking. It seems that we are responsible for both sides of this business, and we involve ourselves very heavily in everything that improves the empowerment of the patients and alleviating their lives and also the lives of personnel. It was mentioned at the previous panel whether the means that we use to provide solutions for healthcare system in Poland are used for the purpose of evolutionary changes that are now going to improve the system going forward, or rather to put out fires and fill up gaps in a system that is actually punctuated, full of holes. So I believe that, or I'm absolutely convinced that the previous one, that the former one, is very important to merit strengthening. But due to our multi-annual perspective, we can conclude that the system has never been treated as a long-term security for our healthcare security or safety. It's never been treated as a primary task. Let's have a look at a statistical doctor. The age, intention to use modern tools. I believe that most of the doctors are old age, with most of them also able to use those tools, but since they don't have ergonomically designed tools, they're afraid of their knowledge and skills not being used in the correct way. Also, the patients should demand traditional assistance, traditional treatment. So the new tools are required, but there must be a right balance, as everywhere in the medicine it is dose that matters, and repeatability is also, or duplicability is also important. As the previous speaker spoke about IT solutions in the US, the anesthesiology wards, I can believe the same progress in Poland as well as AI. We are absolutely at the threshold of the new, let's say, era. But unless we develop very convinced medical personnel, there is many examples of great leaders, and we should promote such postures. We should nonetheless bear in mind that we have a group of doctors without whom the system will be even more incapable as it is today. Thank you very much. Another person is the chairperson of the Foundation Ask Patients.
Całych jakby świadczeń zdrowotnych są pacjenci, o czym...
I believe the whole system is addressing the patients. Now, from the point of view of patients, how would you define the objectives of the growth or development of this whole system? Thank you very much. My foundation has been participating in the e-health forum from the very outset. We have emphasized that the e-health system should focus on the patient as the main recipient, or client, if you like. I rejoice over what I heard in the presentations until now. That helps me think about the future with optimism. All the demands that were voiced resonate with me very well, because they're all geared towards improving the situation of a patient. In my opinion, the biggest challenge, however, lies in the system being able to respond very accurately to the needs of the patient, and to give the patients secure access to medical data.
Well, effective e-health solutions are solutions that put the patient first and ensure adequate protection and help build the patient's position, like we've said today, building patient's empowerment. The patient is conscious, well-educated, well-informed, and able to co-decide and take joint responsibility for his or her health therapy, is able to cooperate better with the physician. Well, patients have been waiting for different health solutions for a very long time and are keen to benefit from them. So we are waiting more solutions. We want to fully participate in the system online. We want to see more functionalities of the e-prescription. For example, the prescribing doctor should be able to see what other drugs have been prescribed to the patient to avoid any possible interactions. So we are also looking forward to very simple solutions. For example, what is missing right now in terms of access to medicine, reimbursed medicine for patients 75 years and over. There are many drugs missing in pharmacies. Specialist physicians should be able to prescribe those free of charge drugs. This functionality will be implemented, but later, at the end of the year, and we are keeping our fingers crossed that this deadline is finally met. So we really look forward to different expansions of functionalities of patients' online account, of e-prescription, and e-consultations should be conducted in a way that makes the patient's life easier and provides patients with more access to medical services and is not a substitute. Thank you very much. The next panelist is a physician, Tomasz Zieliński, Vice President of Zielonogóra Agreement. So what should be changed or improved from the doctor's perspective? Hello. Well, from the doctor's perspective, what matters most is to provide better healthcare, especially when the number of health needs is on the rise. Patients have more and more needs because we live longer, because we get sick more. There is morbidity, and health workers, their efficiency is going down because we are aging. The average age of a health professional is going up, and this means that you are no longer as effective as before. So in order to achieve this goal, we need to ergonomize work. Well, we've had statements today related to it. From our perspective, what is wrong is the number of websites, the number of portals we have to use is going up. It is our objective to reduce the number of portals we are committed to use. So in the surgery, our app should connect with the National Insurance Fund, with different websites, because everyone is creating a portal for healthcare professionals. And of course, very often there are apps that ensure connectivity and interconnectivity, but it's not 100%. So together with the Polish Chamber of Healthcare IT, we are championing one keyboard project to make our life easier. And because the number of e-records, e-prescriptions, e-referrals, we are also indexing medical events, and the number of digital data sent to a medical professional is going up. So in such circumstances, we should be providing the healthcare professional with excerpts, with key information, and not a list of documents that should be browsed, because paper documents may be browsed easily. You just glance at the document and take the next one into your hand, but when you have to download a document, go through it, it's much more time consuming. So automation of data exchange and reduction of addresses to which you have to send your data. This will save time and give us more time to attend to the patients. The more data we collate in IT systems, the more we should be reducing their circulation. A great example from the times of pandemic, when you refer a patient to the COVID test, you don't have to report it. And if the result is positive, you don't have to produce the official statement of leave of absence or sick leave, because this functionality has been automated. I know time is running out, but I'll try to sum up. Telemedicine, development of telemedicine, this is a major issue. I'm not going to dwell on this because I know there is a separate presentation. So remote patient supervision, right now there is a project stimulated by the pandemic. Supervision of COVID patients will be able to monitor saturation. The project's name is PulsoCare. And with the growing needs and few resources, it will contribute to automation of the process. And last thing I would like to address is storage of records, storage of documents, small entities with no extensive infrastructure. When you produce medical records, and if you want to store it locally, it won't be available and shared with other institutions, which is why cloud-based solutions are essential, especially for small surgeries, for individual physicians who see patients once a month, who close their laptops and provide no access to their data. Okay, without further ado, I'm going to finish now. Thank you very much. Okay, right now let's talk about telemedicine. Legal counsel, senior associate of DZP legal firm, Jan Pachocki. You're one of the founders of Telemedical Working Group Foundation. So how would you define opportunities opened up by telemedicine? Well, first of all, thank you very much for inviting me. I'm very happy that just like we've managed to get on with the health strategy, that we are following up on the debate initiated by Mr. Pruszko several years back on e-health and its benefits for patients. Well, telemedicine, its basic objective is defined by the health strategy. It should optimize healthcare for the patient. It should improve its efficiency and availability. It should be helping healthcare professionals. So this is what it should be doing, and the key is the answer to the question how to do that, how to achieve that. There are several documents, elements relevant to e-health and telemedicine. The first one is strategic approach, which is why we should be supporting efforts on the health strategy, because a robust health strategy will respond to needs and will provide the public with ever improving health services, which are beneficial for the patient. And of course, if we do it well, if the health strategy will be persistently implemented according to the plan. And by the way, I'm very glad to learn that AI and telemedicine have been mentioned because this reflects a much wider perspective than just digitization and exchange of patients' data. AI is the key, and technological innovations are able to significantly improve operations of the system. The second element, and it has been mentioned today, is a system based on evidence, knowledge, and standards. In telemedicine, we have organizational standards for primary healthcare, which is mandatory for primary healthcare professionals. But it's also a repository of knowledge that benefits physicians, which is why standardization in telemedicine should be continued. And we should introduce unified standards to all healthcare services, to all healthcare services providers. Of course, I do know that dermatology and general practice have different standards, but I think nevertheless that standards should be unified. Standardization is reflected in many different ways. For example, in personal data processing, you have to anonymize data. All healthcare providers need to know how to safely anonymize data to share them later, because otherwise we'll be prone to mistakes which will affect and impact the safety of patients' data and the patient's health. So another important thing to be dealt next year, there are several profound legislative changes underway. Development of safe patient information. I think we will see a new act on patient information. These should not be regulations governing medical records. They should govern all sorts of patient data and act on quality in healthcare. This is another pillar of a modern healthcare system together with a modern governing body. But you need to earn patients' trust. They need to report adverse events. Plus, introduction of innovations to the basket of guaranteed services, IT and telemedical innovations should be also covered by this range of services. And finally, implementation of changes, because there is a whole variety of changes. Reinforcement from the public side, digitization, e-prescription, gained momentum when the new Minister for Digital Affairs was appointed. And right now we have a brand new Ministry for Innovation, which will be the owner of the process. So if the process is implemented efficiently, we can look forward to measurable benefits. And there is another measure, wide and effective collaboration between healthcare professionals. This is a very complex issue, and I don't think anyone is able to cope with it alone. So you need to build bridges to ensure ongoing cooperation, and implementation of this concept will also require support. Okay, final two words. What else can we do to prevent the pandemics? Well, the first step forward was marked with introduction of e-consultations, which should be further standardized to boost their quality. And the second element, which is already happening but should be accelerated, is introduction of specialist telemedicine. We see a bit of it. Right now we are monitoring saturation, but there are very different telemedical services that may help patients from the risk group, that may be provided with much higher standard healthcare than today. Thank you very much. Thank you very much. And right now, Rafał Błach, director of CompuGroup Medical Polska. Well, are we pursuing right goals and guidelines? Good afternoon. A short digression, because we've reached a place where we see very dynamic development of e-health. But if we look back on the history of innovations back in the 70s during the fuel crisis, as a result, we saw for the very first time fuel-sober power units. Right now, in the times of COVID-19 pandemic, there is a surge and need for safe interactions of patients and medical professionals. So it is creating an unprecedented situation for development of e-services. Well, good, because aligned to those needs is the strategy for e-health developed on the central level. It will benefit patients and health providers and IT providers alike. To identify future activities, you need to know that for the strategy to work, you need to have three things. Well, the strategy itself, you need to have adequate investment funds mentioned in the first presentation, and you need to have massive public trust, public confidence in health products, in IT solutions that will replace the physician to a certain extent. For example, AI-based solutions or analytics-based solutions that will help the doctors or replace them to a certain extent, because we need to realize that sooner or later, when we rely on such solutions, questions will be asked. How to respect one's privacy, how to ensure customized or personalized approach, and how to provide personalized healthcare. Despite massive and rapid technological growth, we are not fully able to eliminate the human factor from the diagnostic process. And even in processes supported by AI, well, you know, it is man who takes the final decision. So working on e-health solutions, we are focusing on the human factor, because we don't want the patient to have a sense that the whole process is depersonalized, that solutions geared for the patients are reduced to communication or are reduced to, or pigeonhole the patient, or make dedicated care non-personalized. Because what is important worldwide, in case of most diseases, we will be pursuing personalized therapy. So this is my, key point. We need to keep in mind that IT solutions cannot in no way dehumanize the patient and the healthcare professional. Well, thank you very much for your statement. Because time is running out, I will ask to recap for 1 minute Marta Brożyna and later Michał Bedlicki. I do apologize. So to recap previous statements. Well, ladies and gentlemen, well, we all take a different perspective. We do know that we need to undertake measures, that we need to identify specific guidelines for activities, which is why the initiative we have proposed to put together the health strategy is very much needed for the patient and for the medical community alike, as well as providers of IT software. Thank you very much, Michał Bedlicki. Okay, the famous last word in our discussion. I think all panelists today are anonymous. No one alone, no party alone will be able, no matter what the strategy is, will be able to implemented single-handedly. So interplay, cooperation in all areas is required. And our solutions are meant to serve and benefit the patient. Okay, so thank you very much for making a contribution to our discussion, to our panel. I think very notable is the fact that everyone have agreed. You know, it's very often the case that during such panel discussions, various panelists are arguing and squabbling with each other. It was not the case this time, not even once. It's interesting. I wonder, it's because we are online or we are like-minded in the strategy department. Well, we are very hopeful and we really look forward to success, because I can't imagine how healthcare would look like if we do not succeed. Thank you very much, and over to organizers. And thank you very much as well. You know, in the atmosphere of concord and agreement, Tomasz Judycki of the Polish Chamber of Healthcare IT.